Triage Days is a quarterly training that will allow EMS, nurses, physicians, and other medical staff to practice using the mass casualty triage system by becoming familiar with the algorithm, colors, and triage tags in case of a real mass casualty event. St. Joe County has moved to SALT Triage. While the algorithm isn't much different than the previous triage system, the method of noting the triage colors and documenting the patient encounter has changed. This process change is meant to speed the process of initial triage while allowing for more adequate documentation during the evaluation, transport, and treatment phases. SALT Triage, which stands for Sort, Assess, Life-Saving Interventions, and Treatment and Transport, is a CDC-sponsored project which set out to find the best practice for mass casualty triage based on the best available evidence. SALT Triage has been endorsed by the American College of Emergency Physicians, American College of Surgeons Committee on Trauma, and the National Association of EMS Physicians. SALT Triage has four main components: global sorting, initial assessment, life-saving interventions, and treatment and transport. For full explanation and training, please see the SALT Triage training video linked in the description. During this event, unless there is a true MCI, the sort portion will likely not be used. Triage Days will run for a 24-hour period starting at 0700 on the scheduled start date. The event will take place once quarterly, with the exception of the first 2 quarters in 2024, in which case it will be run 3 times to make sure that we catch all 3 EMS shifts. During the drill, each patient will be triaged according to SALT Triage and will receive a triage ribbon and a triage tag. This will be further explained shortly. Each hospital can choose whether to activate an internal MCI drill or further expand their involvement as they see fit. For reference, here's a graphic of the SALT Triage algorithm. For full explanation and training, see the SALT Triage video on St. Joe County EMS's YouTube channel or the free online SALT Triage training course on the NDLSF website. During the drill, each EMS patient should receive a triage ribbon and triage tag during transport. On all patients, EMS should make sure the patient's name, vitals, interventions, and initial triage color are documented on the triage tag. If a patient doesn't receive a ribbon or triage tag by EMS due to short transport time or other extenuating circumstances, the nurses should place a ribbon and triage tag once the patient arrives at the hospital. For a patient who self-presents to the emergency department through triage, the triage nurse should place a ribbon and triage tag on the patient. Real patient information should be used on the triage tags. Once inside the emergency department, nurses should ensure that the areas on the triage tag, which were previously mentioned, have been completed, and complete those which have not been completed. Each nurse should fully fill out at least one triage tag during his or her shift for familiarity. This includes interventions, redocumentation of vitals, etc. This does not need to be done on every patient, however. Please note that during this training, regular charting in the EPCR or EHR by both EMS and nurses is still required. It is acceptable if due to extenuating circumstances a ribbon and triage tag cannot be completed on a specific patient. Patient care will always take priority over this drill. Communications on the iHern during the drill should be kept short. This is because in a real MCI, multiple patients could be arriving back to back to back and the radio needs to stay open. Medics should call in and give a short 2 to 3 word description of the patient along with the triage color. For example, Memorial Hospital, this is ambulance 15, en route with a single yellow 47-year-old male with chest pain. No STEMI, ETA 5 minutes. Make sure to give the number of patients, as in a real MCI, a single ambulance may be transporting more than one patient. Please note a full report should be given on specialty patients, such as a STEMI, trauma, stroke, or other unique situation. In St. Joe County, we use 5 colored ribbons to denote the triage priority of the victim. These include a black and white striped ribbon, a gray and orange striped ribbon, a red ribbon, a yellow ribbon, and a green ribbon. As noted previously, the black and white ribbon signifies a patient that has been triaged as dead. We use a black and white striped ribbon instead of a solid black ribbon for the ease of visualizing the ribbon in low light conditions. We use a gray and orange striped or solid gray ribbon to signify that a patient has been triaged as expectant. Expectant means that the patient is not likely to survive given the resources available, but the patient is not dead yet. And if resources become available, the patient may be transported for definitive care. Red is used to denote a victim with immediate life-threatening injuries, but they are expected to survive given the available resources. These patients should be transported first. Yellow is used to denote a victim who may have serious injuries and will likely need to be seen by a physician, but does not necessarily need immediate transport. The patient is expected to survive. Green is used to signify that a patient is walking wounded and may or may not need medical intervention. Finally, a pink ribbon is used to denote a patient who is contaminated and will need to be decontaminated prior to transport by ambulance or definitive evaluation in the emergency department. Here is a picture of the new triage tags. The bottom portion will be removed prior to transport from an MCI. If still attached, such as in a patient who self-presents to the emergency department through triage, the triage officer in the emergency department should remove it and use it to track the patient along with the HICS 254 form. Note we don't have any rubber bands or strings on the triage cards. Use the ribbon to tie it on. If the patient's condition changes, remove the ribbon and change to the appropriate color, but use the same card. In a real MCI, the card will have a barcode on it, which will tie the patient back to their belongings and transportation destination. Fill out the name, gender, age, initial triage color, and initial vitals at a minimum for each patient. As noted before, each medic and each nurse should fill out at least one triage tag in its entirety during the 24-hour event. Note here the bottom portion of the triage tag has been removed. This is how the triage tag should appear in a real MCI when the patient arrives at the hospital. The triage tag should be filled out at the CCP by the medics transporting the patient, or both, depending on the situation. The top portion includes the patient's name, allergies, age, gender, and initial triage color. A list of major injuries should be documented in this next section. Finally, vitals should be documented with the confirmation of the current triage color or assignment of a new triage color based on patient condition. The backside of the triage card includes IV or IO access, as well as fluid infusions. The next section includes interventions performed as well as medications given. Finally, additional notes can be added as well as where the patient was found during the incident. This last part of the triage tag is for use by the triage or transport officer at the scene or the triage officer at the hospital if the patient self-presented. The smaller tear-off portion is to track evidence in patient belongings. This portion of the tag will not be used during the triage day's drills unless the EMS agency wishes to do so. Eventually, we will use these for patient tracking using the HICS 254 form. If there are suggestions for improvements on the triage tags, please send feedback to your EMS chief or emergency department director. As always, please reach out with questions, and we hope this triage drill will help facilitate the knowledge and muscle memory needed in case of a real MCI.